Hi, I'm Dr. Jack Ringer, and I'm here this morning at Keating Dental Arts, and we're going to treat a patient today who has a significant problem of wear with his front teeth. So his name's Daryl here. Tell me, what do you think about your mouth? Why are you here? What's going on?
Well, I'm aging a little bit, and my mouth's getting a little bit old, and my teeth are being worn down, and I want to get back on a natural smile.
Daryl, after you had explained everything to me, what you'd like to do, I had our laboratory design what we think could rejuvenate your smile. So we built a whole model here for you in wax of what you could end up looking like. Okay? So we based this when you and I were talking about what you wanted, the length, the shape of your teeth. So after today, when we've prepared all your teeth, we're going to put on custom prototypes that are going to duplicate this. So as ugly as your teeth are now, that's the last you'll ever have of it. As of today, you're going to look great. When these are all done and you like your prototypes, the laboratory is going to build the new ones, the permanents, and you'll come back a second time and we're going to bond everything. So let me tell you how the whole procedure is going to work. I'm going to put you back in a second and we're going to numb your mouth up. Okay? Now we do this differently than conventionally. We're going to use a device that's computer-assisted anesthesia. Okay? It's a machine that's going to inject a drop at a time of anesthetic. We're going to start on your top teeth because we're going to be doing 9 teeth on your top today and 9 on your bottom. That's a heck of a lot, 18 teeth. But you're not going to feel anything. The numbing on the top is going to be done on the roof of your mouth, okay? And it's not going to numb up your face, which is really cool, or your lip. Just the teeth and the gums. The bottom, when we numb you there, you're going to get a little bit of lip anesthesia. Your lip will be a little bit numb, but not your tongue. So after I've got you numb, part of your problem too is your gum line is a little bit low and your teeth are really short. So I'm going to use a laser, and this is a very cool little device here, okay? And I'm going to remove a little bit of your tissue right there to give more tooth length, all right? Then I'm going to put you back, or keep you back, and then we're going to start preparing all of those teeth, all right? Once they're finished being prepared, top and bottom, we're going to take some measurements, and then we're going to use this device here, a digital scanner, and take an impression of everything, and a digital bite. Once we're done with that, we're going to make you custom prototypes based on that model we made of you, and take some photographs, and then we're done. Any questions? You ready to rock and roll? Is the AMSA injection, anterior middle superior alveolar nerve shot. And when it's done, we're going to see blanching of the gingival tissue. The palate will be numb, but he will have no lip anesthesia, which is great for assessing facial aesthetics when everything is done, when we have his temporaries in it. Stay open, Daryl, okay? Where's that other carpel?
Amazing.
Cool, how the roof of your mouth's all numb.
Amazing. Wow.
But your teeth are all numb too, but not your lip. Okay, I'm going to give you one more, a little bit over here. Turn towards me. Okay, right over about here. Okay, so you'll feel maybe a little tiny pinch, maybe not. That's all you'll feel. All right, you should get nice and numb in a minute for everything. Obviously, if when I'm working on anything, you feel anything, you just mumble and I'll add more Novocaine or juice or whatever you want to call it. Okay, we're almost done here on the top with the numbing. In dentistry for years we've had lasers. When we're going to remove soft tissue, we use soft tissue diode lasers. And not too many years ago, it was like a whole big box machine, you plug in wires, everything. Well, technology has advanced so much, we now have these little portable things. You can see it's a little light thing. And this is purely soft tissue. It's not a powerful laser, but for the purposes that we're going to do here, it's awesome. You'll see in a minute. Just sculpt away the tissue. There won't be any pain, no bleeding. So here we go. Okay, turn towards me. Now it's Daryl's case. When we did his exam and diagnostics, we found out that there was, we sounded the bone and there was plenty of free tissue here to take off, so we're not violating the biological width here on him at all. So because we have a diastema, we also want to go through the mesial, take a little tissue off of there, but we don't want to damage that papilla. That's great. Face me, let me have a look, see if that's symmetrical. That looks perfect. All right. I think we'll just do a hair on these two teeth and then we can start preparing the teeth themselves. That all looks perfect. Okay, so as soon as you're numb, we'll start drilling. We're good. So for your front teeth, we're doing, we kind of call taco shell veneers. You've already lost a lot of the edge of the tooth. So we want to wrap the porcelain a little bit over the back side, so that's what we call a taco shell. They're pretty dark, so we want to give the ceramus a little extra room in order to create nice optics in the ceramic so they don't look opaque. So instead of reducing maybe a 1/2 millimeter, we'll reduce about 3/4 of a millimeter to give the ceramus room. Okay, that looks good there. So we're going to break contact on all of these. One down. How many to go? 17? 17 to go. Next step, impressions. And we're going to do this digitally. All right, so what we're going to be doing is we're going to use a camera to take a picture of all your teeth. But I'm going to first put this thing in, it's going to hold your lips back. Okay, so I don't think we need any paste, at least not for the upper. Okay, so we're going to put this in. So now what we're going to do is dry these. Put a little powder on the teeth. you teeth that duplicate your wax design. Let's see how this fits first. Open. So we made a custom stent here that fits. So now to keep open, we're just going to put a little adhesive on the teeth. Close lightly and just stay together. Okay, we'll let that harden for a second. Okay, as soon as that's set up, we'll clean off the excess and we'll put the bottom ones on. 1M1 for 7 through 10. And then maybe transition to like a 1M2 from 6 back and 11 back. And do the same thing on the lower 23 to 26, 1M1, and then further back 1M2. And to build an incisal translucency and make them polychromatic. All right, so Daryl right now is in his custom provisionals. So when we pull back, we can see the provisionals there. We had removed a little bit of gum tissue at the gingival margin to give him length and lengthen at the biting edge, the incisal edge. And if you see here his design, his prototypes pretty much match those. So these are bisacrylic temporaries on the top, and he also has on the bottom. We've used a pretty generic shade. It's a 1M1 or an A1 shade, but in his finals, the ceramist will build in translucency and polychromatic colors. And you can see we've lengthened his teeth now are about 11 millimeters long. He had started with under 8. So you can see a huge improvement. All right, so we're finished with Daryl. So I'm going to give you a bit of a summary right now of what we did. You saw earlier the way he started off. So after we numbed him up using the wand anesthesia, we did a little bit of gum work to give him a little bit of length at his gum line. We then prepared all his teeth. We did a little bit, like I said, some laser work. And we also then took a digital impression. So if you look at the screen on my right, you can see all the teeth that we prepared. We did 9 teeth on the top, 9 teeth on the bottom. And then ended up, after the digital impression was done, putting in, you can smile Daryl for the camera really big, custom prototypes in a bisacrylic temporary material. And our next step will be sending this all off to the laboratory. They're going to make the ceramic restorations.